Good morning, everyone. Hope you're having a great start to your week and great start to your month for that matter. Hard to believe it's already February and we're 1 month into 2024. Um, that being the case, also quickly coming up on Valentine's Day, and so that being said, on today's episode of Tooth Teacher Tuesday, on our Oral Pathology Corner, I want to talk about something that kind of puts me in mind of Valentine's Day. It's a particular lesion that is, you think of Valentine's Day, you think of the color red. This particular lesion is known for its red appearance as well, and that lesion is something called a pyogenic granuloma. Um, and like most of our funny dental words, basically what that lesion is it's a red bump. Most commonly occurs on the gums. It can occur other places in the mouth as well, but it's a red bump. Sometimes can have a blue or purplish tint to it. It's something that also bleeds very easily, so it's pretty distinct and it has fairly rapid onset as well. And kind of an added connection with that is, you think Valentine's Day, you think of Cupid, you think of babies, and that's where pyogenic granulomas can occur for any of us, but they are especially common in women who are in the middle of pregnancy. Um, any woman who's been pregnant probably has experienced, maybe not as a hard, fast rule, but a lot of times with pregnancy, the gums are prone to being kind of red and inflamed and bleeding easily, and that goes away after pregnancy is over. And pyogenic granuloma is just kind of a exaggerated version of that, at least in pregnancy. And so to give you an idea of what it can look like, again, many different appearances it can take on, but generally pyogenic granuloma is going to look like something like this. And treatment kind of depends. Like I said, if with it being a common finding in pregnant women, usually we leave it alone for pregnant women because when the pregnancy's over, it'll resolve itself and go away. Just really the biggest thing is maintaining good hygiene around it to keep it clean, keep it from growing and becoming more irritated. For someone who's not pregnant, in that case, it's a little bit more concerning because we're not quite sure what's causing it. And so in that situation, recommendation is to remove it surgically, just cut it out of there, and then follow up with it pretty routinely. Because with pyogenic granulomas, outside of pregnancy, they do have a pretty high rate of recurring. So just because you cut it out, even if you get all of it out of there, a lot of times they like to come back. And, we don't want to leave those untreated because a lot of times they just continue to get bigger and cause more irritation in the gums, around the teeth, and that can lead to a whole host of other issues for your teeth. So definitely not something you want to neglect. Shouldn't really neglect any bump on the gums. We've talked about several different bumps on the gums in the past, and this one's no exception. Definitely something to take seriously. So hope you found this interesting and helpful, and thank you for tuning in, and look forward to seeing you on the next edition of Tooth Teacher Tuesday. Have a great week.